a dialogue series that we bring forth to try and have a deep dive conversation on issues which are of importance, more so at least, for the students of public policy as future policymakers to try and get an understanding from those who are practicing these policies on a daily basis, from those who are formulating these policies. And while in the last episode, we spoke about the issues of health-related policies in a post-pandemic era, today we're going to just follow it up with another very important conversation, because in these times of pandemic, the one issue that has been a subject of conversation, and rightly so, and needs to be much more focused on, are the issues of mental health. And a lot of times, of course, mental health, along with the socioeconomic complexities that lead to suicides as well. How can these suicides be prevented? How can mental health, in fact, the issues, the challenges be identified more so at the levels of government, at the levels of authorities? What kind of policies are we looking at in India? The numbers are very stark. And if I could just start with some numbers that we actually have, as far as the National Crime Records Bureau is concerned, it says that India recorded over 1.53 lakh suicides in 2020 alone. This is, of course, the year that we saw India face one of the strictest lockdowns following the pandemic outbreak across the world. So there were estimated 418 daily suicides in 2020. The suicide mortality rate had gone up sharply compared to 2019. There was a sharp spike in suicides among students, almost a 21% increase in 2020 compared to a 7 to 8% in the past. So these are all worrisome indicators for a country that is complex, for a country that is young, and for a country that is going through multiple challenges. Also, in terms of the gender lens, we need to understand that the suicide rate among Indian girls and women, it continues to be twice the global rate. So how do we really talk about the mental health crisis? How do we destigmatize? These are issues that I am going to discuss today with a fine panel here of experts who have been practicing all of these issues. Tanmay Goswami, he's a mental health writer based in New Delhi, somebody who helps us all understand, of course, through a lot of his personal experiences too. He launched Sanity by Tanmay as a health-related newsletter in December of 2020, and the family has actually grown very impressively. This turned into a full-fledged global community of creators and lived experience experts. Prior to that, he had 2 decades nearly of experience in business reporting and editing. Thank you, Tanmay, for joining us here at the conversation. I also have with me Chavi Rajawat. She is a former Sarpanch. In fact, she was one of the youngest persons to be elected as Sarpanch and represented the Soda village in Tonk in Rajasthan. She is associated with the Eminent Girls College in village Soda, which actually aims at providing young women from rural sectors platform to harness their potentials, to develop their talent. And Chavi has also been working on mental health areas, especially in the rural households there. Thank you so much, Chavi, for finding time to join us here in the dialogue. I also have with me somebody who is very, very eminent, Dr. Soumitra Pathare, Director, Center for Mental Health Law and Policy at ILS Pune. He's a psychiatrist. Dr. Pathare in the past has actually provided technical assistance to the Ministry of Family Health and Welfare and Government of India in drafting India's new Mental Health Care Act of 2017. He was also a member of the Mental Health Policy Group appointed by Government of India to draft India's first national mental health policy, which was released in October 2014. He has served as a WHO consultant in many low middle income countries. And recently, in fact, he co-authored a book, Life Interrupted, Understanding India's Suicide Crisis, along with Amrita Tripathi and Abhijit Nandakani. Thank you so much, Dr. Pathare. It's a pleasure to have you. And last but not the least, the youngest member on the panel today, I have Lavanya Uday Verma. She is a student who is in college currently in Delhi University, an aspiring filmmaker. But also we decided to have Lavanya on the panel because very recently she's actually created this short film, and it is on YouTube. You can go and search for the film. It's called It Is Not In My Head. It also features her young brother, in fact, Arjun, who's playing who's portraying a depressed young student in that short film. And I thoroughly, in fact, I completely would recommend all of you to please go ahead and look up that film. And Lavanya, in fact, let me start with you, because as the youngest voice in the panel here, what made you want to talk about the issues of depression, anxiety in that film that you chose to make?
So, while growing up, when I entered my teens, I started to feel that I used to get stressed quite a lot. And when I used to talk about it to my friends, they used to just brush it under the carpet. They were like, "You're just overreacting." And eventually, I thought the fault is in me. Then gradually, I noticed around me that people like take my friends for example. There were certain friends of mine who were suicidal, and they weren't getting any support from their family, from their friends. They kept asking their parents for therapy, and they all were gaslighted, manipulated. So I realized that there's this stigma around mental health which needs to be addressed. Even in my school, ma'am,
Mhm.
teachers were really dismissive of mental health. Everyone focuses on physical health, but how no one understands the importance of mental health. This is what I've noticed, especially in our Indian society. If someone wants to consider therapy, people just call them names, and they're like, "Tu pagal hai kya?" They use terms like this. So an issue like this, awareness has to be generated regarding this issue. And it was always my dream to make a movie on this topic, because I think more people should be aware about this issue.
Right. And what was the reaction to the film once you made? Are your friends today talking about it now?
So the reaction was good, because many people who saw it actually I they started to cry. So I think a lot of people are relating to that movie, because over the years mental health issues have only been repressed in our society most of the times. So I hope that after watching this movie, more people will get the courage to ask for help.
Mm. Conmoy, you are somebody who creates a lot of content around mental health issues. You know, from the time perhaps 10 years back, 15 years back, and when we were young people, and when we were, of course, going through our own anxieties and all, to now, do you think it is easier to have a conversation around mental health today with peers, with people? Is there a better, slightly improved perception and understanding of the subject?
Yeah, thank you for having me, Smita, and congratulations, Lavanya. Very good to hear that you've taken control of
Thank
that narrative yourself.
thank you,
Um, I,
sir.
I think, Smita, to answer your question, it's a very tricky question to answer, because my intuition is to say yes, because that's my experience. I am a cishet upper caste man, so I tick all the boxes of privilege. The only thing I'm not is white. So I can very easily say that these conversations have become easier, but that is far from the reality. And I think, I mean, Lavanya, for instance, I mean, if her generation is struggling to talk about these issues, then what is this grand opening up that we are really talking about? I think it's very important to differentiate the reality from the sort of media frenzy that we see around this idea of mental health, pop culture, media, celebrities talking about it, all of which, by the way, in isolation, they're all important. It all adds up to people having more conversations about the subject. But even between, let's say, 2016, when I first publicly wrote about taking a break from full-time work because of depression and suicidality. By the way, trigger warning: if anybody gets triggered by these conversations, please step away or seek help. Um, Between 2016 and 2022, and in 2016, this was not quote unquote hot. Very few people were talking about it, especially in journalism, which is a macho industry where we don't talk about weaknesses, quote unquote. Even in these 6 years, certain things have definitely changed for the better because of the sort of activism and advocacy and legislative changes of the kind that Dr. Pataria, and others have brought in. But I am very deeply suspicious of any narrative that says, for instance, there was a report recently in a major Indian newspaper, English newspaper, that said stigma is passe now. Indian youth are very okay with taking therapy. It is not a stigmatized topic at all. And this is so problematic because in a country where, political leaders always use mental illnesses as terms of abuse to berate each other, what kind of destigmatization are we talking about? And finally, I think a difference needs to be made between stigma, which gets a lot of attention and rightly so, and discrimination, which is really the sort of the substratum on which stigma proliferates. And on that front, I think we're still very, very far from turning a corner.
Dr. Pathare, taking forward what Tanmoy is saying, and if you were to give us a sense today of really the kind of the big key red flags for India when it comes to the mental health issues today, where do you see some of the biggest problems lying today? Is it the approach of the authorities? Is it the societal approach? Is it still faulty, in fact, policies that are being adopted at the levels of states? What would you say are the biggest problems today when it comes to the challenges of mental health in India?
Hi, thanks, Smita, for asking me to join this panel. I think everything you said actually is a challenge. So to say which is the biggest is always a difficult one when everything is the biggest. But I think some of the things that we need to really kind of, I would like to backtrack a little bit and say, when we say challenges facing India, which India are we talking of? Because there are multiple Indias. There is an India which is very urban, English speaking, which has its own particular sets of concerns and is far more probably aware of certain issues. There is another India which is rural. There is an India which is rich. There is an India which is poor. So it all depends on, when you say what are the major challenges, it really depends on which particular section, which particular India that one is trying to address in many ways. I quite appreciate Lavanya's effort in trying to raise the awareness issue around mental health. But look at it this way, look at the data on mental health treatment, for example, across the country. There's a national mental health survey, which basically found that 80% of people who need mental health treatment do not get it. So you could always think of, if you were an economist or if you had anything to do with economics, you would say there is a demand side and there is a supply side. Now, clearly, if the supply side is resulting in, you got a shortage of supply side, if you got a treatment gap of 80 to 90%, the challenge is not on the demand side, the challenge is on the supply side. So, there are people who want mental health treatment but are not getting it. So while you might say, well, what the awareness will do is increase your demand side, it won't increase your supply side. And so if we are going to be doing awareness, then that needs to go hand in hand with supply. My biggest concern has been, and I use this metaphor always, which is to say that it's like letting people know that you are hungry, but then saying that, well, actually, there's no food on the table anyway, but you are hungry. What does that do to people? So I think if we are going to do awareness, then that has to go hand in hand with improving the supply and availability of help of all kinds. And when I say help, doesn't mean only being able to see a psychiatrist, because mental health help can be a range of things that you would end up doing, and some of it might be also seeing a psychiatrist. And the second broader issue that we need to kind of we need to understand is that mental health issues are extremely closely linked with social, cultural, and economic factors. You can't be thinking of mental health in isolation as a purely health-related issue. I mean, to give you an example, which I use all the time, is in 2008, you had the financial crisis in Greece. And, basically, Greece was in real trouble economically. And they saw their employment rates go up 25, 50%. Young people below the age of 25 had unemployment rates like almost 50, 60%. And what you saw as a result of that, with a certain lag in the years following it, is that Greece's suicide rates dramatically went up in the subsequent 4 years. So in 2008, nothing happened. 2009, they went up. 2010, they went up further. 2011, they went up. And it was only after 2012 that they started dipping. So the thing is that the only reason Greece saw this sudden increase was because of the economic crisis, unemployment, people getting, poverty. So you can't be thinking of mental illness, mental health problems, and suicide without actually contextualizing it with the socioeconomic status. Like poverty and mental health has a very clear bidirectional relationship. The poor are more likely to suffer from mental health problems, and people who have mental health problems end up becoming poor. I mean, that both of these things have been proven by research. So I think it needs to be, we need a far more contextualized way of trying to discuss who needs what, where, when, and how. Yeah, thanks.
I'll come back to you with a lot more follow-up questions, and to all our audiences and our young participants here who are joining us through various social media platforms, we will take your questions in just a few minutes. But Chavi, this India that Dr. Soumitra Pathare talked about, that we are living in multiple Indias. You are actually dealing with one of the Indias in a village, where you are in Soda, and you are talking to a lot of women out there. How difficult do you find to even breach the issue, for women to come and talk? I mean, studies show that actually 1 out of almost 4 women tend to be abandoned by their families if they're in mental health centers. So how difficult in the first place is it? Do you see women even willing to come and talk about their mental distress to you?
I think if, am I audible?
Yes.
Yeah. I think that would be phase 2 of the problem. Phase 1, as has already been pointed out, more so in the rural scape, is the fact that people are not even aware that they may even have an issue, or even something as simple as stress. Is that there? Do they even have the time and the wherewithal to think about it? And it's not just women alone. If I look at the youth, I look at the men. And as Tonmoy also said, this concept of a very macho, manly world and the pressures that men go through, who do they have to talk to? And is it okay for them to even speak about it? Because they are, it's where you suddenly question manhood itself, that if I'm venting my issues as a man, I'm not man enough, right? And I think this is a problem not just in the rural scape, but also in the urban scape. So that in itself is a challenge. The concept of abuse doesn't exist in rural areas, right? So that very basic in itself is unknown. And when that is unknown, how does one come up and talk about it? So we do try, like even within our college, which is a purely girls' college, and this is a teacher training college. So we're trying to make these young women aware of these aspects. We have a lady who works in the mental health space as a trained professional, and she comes and gives her time to our students, and in the process also reaching out to villages. So what I've noticed is, as and when that conversation happens, people do become aware and they do want to reach out. So I'm glad that at least through our college, we're able to give these young women a platform where they are able to share things. But how many people have that? As Dr. Soumitra rightfully pointed out, one, we don't have trained professionals. And if we do, yes, it has to be contextualized. For example, someone sitting in Bangalore cannot treat someone sitting in Rajasthan, because we are culturally very, very different, and especially more so for women. How is someone sitting in Northeast going to understand what someone in Northwest of India, what the woman may be going through? Because it's a very, very different platform altogether. It's a very different culture. Also, what goes on within the household, what kind of freedom, what kind of conversations people have within households cannot be comprehended by someone who's not familiar with that local culture. So yes, I do totally agree. It has to be contextualized, but do we have the wherewithal? I don't think so, because the numbers are way too small in terms of the supply and the awareness. I think we have to do far, far more than what is happening at the moment. But I'm glad that someone like Lavanya, with the age that she's representing, that the conversation is happening. But more than that, I think greater awareness, and also, as rightfully pointed out, the supply, that all of that has to fit in. But how are we going to do that given the scale of things, not just in numbers, but also the diversity that our country provides? That is a question that needs to be answered.
Let me take that question, in fact, to Dr. Pathare as a follow-up, because the Mental Health Care Act that you were a part of, it does mandate the creation of regulatory bodies such as the state mental health authorities, the district mental health review boards. Today, do you find them not just in terms of the numbers, but also in terms of quality? Because I don't think that there is a third-party assessment or an independent review that happens of these centers. So in these areas, are there some states that seem to be performing better than the others? Or, what really is your impression of these healthcare centers by and large? Unmute yourself, please, sir.
I would hate to generalize, but what I can certainly say is that there's a huge variability in quality across the country. Which is really a concern, because you don't have any minimum assured quality that you'll get if you went anywhere across the country. There's nothing like, oh, this is the minimum assured quality, whether you were in the north, east, south, or west. Okay, so that's the problem. One of the things that I think the Mental Health Care Act has not attracted attention at all, and which probably should attract more attention. And someone like Shavi might be more interested in this, is that while Rajasthan, for example, and Madhya Pradesh and some other states are now talking about the right to health and a law for right to health, the fact is that the Mental Health Care Act already introduced a right to mental health long time ago, which governments have not worked on. If you look at the Mental Health Care Act, it very specifically says that everyone has a right to receive the following mental health services and lays down what those mental health services are, and that it has to be in every district in the country. And if government fails to provide it, government should be paying the money for people to go to private healthcare for it. And all medicines for mental health care, irrespective of your income, are supposed to be available free from the essential drug list. Now, these are all the things that are already written into the Mental Health Care Act as a right to mental health. And how many governments have implemented. So I'm a little amused when governments say we're going to have a right to health bill. I think, well, you already have a right to mental health bill. You haven't implemented that. Can we talk about implementing what you already have? And it's not something that has attracted attention of the clinicians, because when you speak to the clinicians, they say, well, how does it make a difference to me? It should actually attract the attention of civil society, of activists, of people who work in the social space, to try and get after governments to actually implement that duty that they have. And nobody's actually done that. So while we're talking about quality, I think while quality could be debated and may have certain limitations across the country, and people might say, well, there are problems X, Y, Z. You have a right to healthcare. You have a right to community living. It says people should not be staying in mental hospitals only because their relatives won't take them. That government has to provide for them to have a community living outside the mental hospital. It's government's duty to do it. It specifically says that it's government's duty. Now, none of this is happening. So then, I worry about what we are getting at.
And I have a lot of questions coming into the chat box already. Before I start taking them, Tanmoy, if I would just like to ask you, it's a question that a lot of people do want to ask, is about identifying the triggers, or identifying that somebody needs help. And as a caregiver, there are also sometimes a lot of slippery slopes that we deal with. Is there something, there that you can help people understand that when is it time that you really need to reach out for help, understanding it within yourself or looking out for the symptoms in somebody else?
With the caveat that I'm not a mental health professional and I speak from my own experience. I think one of the reasons a lot of people have this question and the conversation kind of gets stuck at that question: how do we know when it is time to seek help? I think this question arises primarily from us confusing mental health with mental illness. And I think we wait for things to sort of veer towards an illness or a full-blown crisis before we actually seek out, before we actually seek help. So my sort of rule of thumb now is to tell everybody that the moment you feel like you're going through something that is disrupting your life repeatedly, it is time to seek help. Do not wait. Do not self-medicate, do not self-diagnose, do not listen to all the chatter around you that says, oh, this is just a phase, you will get over it. you know your truth, you know your reality. And if you feel like you're going through something that is disrupting your life on a daily basis for a period of time, please don't wait. And when I say this again, in the context of everything that has already been discussed, it would be a travesty to not acknowledge that many people, when they know that they need help, just don't have anywhere to go to. And this is where the concept of community mental health is so powerful, because there is enough evidence now, and there are fantastic models all around the world, including one that the Center for Mental Health Law and Policy runs in villages in Gujarat, where school dropouts are helping their neighbors identify sort of very basic rudimentary symptoms of mental distress and helping them prevent these things from becoming major crises. And when they feel that it's time now for them to be taken to a mental health care professional at the nearest primary health center, they do that. So I think, mental health is not an individual's problem. So if the person who's struggling or who's living with these challenges feels that they have a supportive environment around them where people have the basic mental health literacy, then friends and family members can actually be the first port of call. You don't need to run to a therapist or a psychiatrist immediately. So yeah, my suggestion would be just don't wait for you to become ill or see signs of extraordinary crisis. The moment you feel disrupted, try and talk to somebody, with the caveat that I know it's very difficult to find that person sometimes.
Lavanya, when you started dealing with anxiety issues, you said at a very young age, who essentially were your support pillars then? I mean, who is it that you were finally able to talk to?
So I'm really grateful to my parents, because when I opened up to them, luckily they understood it. And that is when I talked to the school counselor, and I did attend some counseling sessions. So I'm very grateful to my parents, honestly, because not a lot of people get this support. So, and also I turned to some supportive friends.
Okay,
So
that's good to know that, of course, your parents, understood what you were going through. And Chavi, in terms of, you mentioned about the demand supply issues, but also in terms of the budgetary allocations that are made towards health. Do you see a seriousness being reflected? I mean, in this budget, I think the allocation was almost around 2% compared to the previous four allocations of some 1%. Do you see a seriousness when it comes to really, trying to tackle this crisis?
Well, there is intent, but as Dr. Soumitra said, it has been there for a while. We have the act in order since quite a while. But I think the challenge will continue to remain because we do not have the trained professionals, or we do not have, as Tanmoy pointed out, communities, because they also need that basic training to be able to help others. But where is that? Is that really happening? And again, when we speak about contextualizing things, even for those who are trained professionals, from what I understand, and please correct me if I'm wrong, Dr. Soumitra, especially you, I do believe that those who do receive the formal training are basically taught stuff that relates more with the Western world than it does with the local. So once they are out of the colleges with the degrees that they have, are they really trained to immediately understand what the local needs are, and how do we address those? So, but I do believe now with greater awareness, now with internet reaching to the last mile as well in majority of the villages too, I do feel there are platforms through which the connects can happen and people can receive training. I'm not a professional trainer myself, but I guess the very fact that I have empathy and I would like to believe I'm a reasonably good listener. So that allows a platform for people to come to me, be it men, women, young girls and boys as well. And I do see that just being able to vent to someone, just to have someone to listen to you in itself is a huge help. But am I the right person to guide them? I don't think so, because I'm not trained. So how do people like me or others who are working in parts of the world where the trained professional cannot reach, what can we do? I think that's something that needs to be thrown out here for the people who have the expertise to create those spaces where we can reach you and have the basic learning so we can collectively help a larger force and have a larger force at work to help more people across the country. And I think with that, Because just to say that it's the government's job, I don't think is fair, because again, who is the government going to reach out to? Who is that pool that the government is going to reach out to? It's the same pool that exists for each one of us. So what can we do as a collective force is, I guess, my 2 bits for this.
Yes, Tanmoy, you want to come in?
Yeah, I just want to make 2 very quick points about the budget issue. So one is, of course, it is a fact across low and middle income countries that healthcare is chronically underfunded, and within that, mental health care is even worse. But here is something that we generally don't talk about. If you look at the past 5 years, the underutilization of funds that are allocated for mental health care, it's criminal. And this is the reason, if you are not going to be even able to use the little bit of money that is given to you, that is given to all the states and the various programs, that's a real red flag. This doesn't get talked about much. And the second thing is, since we are talking policy, and I'm assuming that a lot of people are interested in sort of the global development sector. If you look at the money that comes in as development assistance for health in low middle income countries, the most recent data I have is from 2015, and money into the mental health sector in LMICs, low middle income countries, in 2015 was $132 million, which was 0.4% of the total development assistance for healthcare. Young children and adolescents, they are 40% of the world's population. Majority of them are in developing countries. Look at the allocation of funds in children and adolescent mental health. And finally, this is not to cue some sort of pain Olympics or suffering Olympics, because all illnesses require attention. If you look at the funding that mental health, substance use disorders, and other non-communicable diseases get per disability adjusted life year, it's less than $1, whereas HIV/AIDS gets $144 per disability adjusted life year. Again, this is not a competition between maladies, but just to put things in perspective, that these are the various financial dimensions of what we're dealing with.
No, I think it's important to understand these dynamics also, these parameters when we are talking about the larger issue. Let me, in fact, now take in some of the audience questions here, and just to
Smita, before you go to the audience question, can I quickly try and answer, because Shavi raised a few questions which I think do need to be answered in a sense, because she did ask that as a question. So this whole and many of your audience have also brought this up about the lack of mental health professionals. And to that, really, my answer is very simple. In the 1960s and 70s, India had a major problem with maternal mortality. We had a real problem. We brought our maternal mortality down now so much that young women are more likely to die by suicide than while during childbirth. We've done so well with maternal mortality. Now, how did we do so well with maternal mortality? If we were to say that, we can't provide maternal and child health services because we don't have enough obstetricians and gynecologists, we would have never been here today. The reason we were able to bring down our maternal mortality significantly is because the government reimagined the way RCH or reproductive and child health services were provided. It required a reimagination. A similar kind of reimagination already exists in mental health. In fact, the most tragic story of this is that India has become a hotbed for all kinds of experimenting new ways of delivering services, which other countries in the world are actually adopting and implementing, rather than we doing it in our own country. So it seems like we innovate, we do things, other countries take up the innovation and run with it, whereas we don't run with it. So I do think that so it is possible, and it's not this, where do we have the mental health professionals, because the same logic could have been said, where do we have the maternal and child health professionals, but we did manage. And the second thing was this whole issue of do we need a mental health professional? I'll tell you what, if you had a cough and a fever, let's say if you develop, mental health is not one condition, or mental illness is not one condition. So let's say you develop cough and fever. What do you do normally? What would all of us do? You'd probably ignore it for a couple of days. That's the first thing we all do. After a couple of days, you might say, I'll try some home remedies on it. It still doesn't get better. What you'll do is maybe ask your family or your neighbors, kuch levu kya iske liye? After 10 or 15 days not getting better, somebody will say, please go and see your GP. So you might turn up at the GP's place. He will give you some tablets for 4-5 days, come and see me again. After 4-5 days, you're not better. He will then say, maybe we should do an X-ray. After that also, it doesn't get better. After a month, he'll say, look, I think you should go and see the chest specialist at the hospital. That chest specialist is the psychiatrist. Okay. Now, what I'm saying is that for mental health, all these steps in between are missing. You have a problem, you have to end up with a psychiatrist. Now, that's just not feasible. It's not practical in any country, not just in our country. If you're going to do that, every cough and cold went to a chest specialist. The chest specialist would not be able to do anything and would probably not see the people he should be seeing or she should be seeing, and end up seeing people who don't need to be seen. So I think some amount of triaging of who needs care and what kind of care is important. And what my concern has been is that in our country, what happens is, especially when care is privately provided, then who gets the care really depends on who can afford it and who makes the maximum noise about it. The ones who complain the most and the ones who afford it the most get it, and everybody else will just not get anything. So, that's another thing that we should keep in mind, that is care being provided based on need or based on purchasing power? And the final thing is that mental health care in this country has unfortunately, devolved down to just biomedical care. Mental health care in this country has become like, here is a prescription, take these pills. Now, I have nothing against pills. Of course, pills are required. But pills by themselves, without addressing a whole host of things that need to go along with that, is not a solution to the problem. And governments think that, oh, tuberculosis ke liye kar rahe, waise karenge, we'll go and identify someone with tuberculosis, or usko 9 mahine dawai denge, waise we'll go and out and identify somebody with depression, usko 9 mahine antidepressant denge. It is not a model which will work for mental health, unfortunately.
Right. Those are very important points. Let me, in fact, take in the questions. Anushka, Tvesh, maybe 2 questions that Dr. Pathare could answer. And, the languages in which the questions have been framed, I think they also speak volumes about people's understanding of the subject. Anushka wants to know that suicide prevention helpline should allow chats too. I faced this issue because I couldn't place call due to some personal reasons. Ishan wants to know, I'm suffering from psychiatric problems. Multiple doctors, therapies, and medicines have not helped. What should I do? Dr. Pathare, if you could answer these 2 questions.
Look, the whole issue with suicide prevention helplines, of course, they should allow chat-based. There are, in India, none of our suicide prevention helplines actually are chat-based helplines. They're voice and phone-based helplines. But that's easier said than done. Remember that every single suicide prevention helpline in this country is run by a set of volunteers and is run on donations. Except, well, Kiran is funded by the government of India, but Kiran is not a suicide prevention helpline. It's a mental health helpline. But every single suicide prevention helpline is run with volunteers and based on charity. And so they have limitations. There are very few suicide prevention helplines which actually run 24/7. Suicide prevention helplines have a huge problem in terms of getting volunteers. It's a high stress job to be a volunteer on a suicide prevention helpline. Not many people can stay on doing it for very long, which means these helplines have to keep on finding a new bunch of volunteers, find appropriate volunteers and keep on training them. So all of these things do need to be taken into account. But broadly, I agree. Yes, you should have a chat-based suicide prevention service. It's something that we are experimenting in very soon in 3 cities with college students and using college students as peers who will be available to provide this kind of a chat-based suicide prevention service. So that's what I would say to that question. And the other question was something about.
But he was going through depression, has changed doctors, and doesn't think that therapies are helping.
What can I say? I mean, it's very difficult to comment on individual case on a forum like this for the simple reason is that I have not, it requires somebody to do a proper analysis, review their case, see what is going on. I mean, the only thing that I can offer is that, look, if you've seen a doctor and you had some therapy and treatment and it's not helping, then maybe you need to go to more specialist places. Maybe you need to go to a place like Nimans. I don't know which part of the country you're in, but Nimans in Bangalore or AIMS in Delhi or CIP Ranchi or, the ones which are specialist and not just the regular psychiatrists that you see at your city level. And maybe that's what you need to do. You probably want to get some specialist help from these places.
Okay. There's somebody called Aditya Oran who wants to ask, ma'am, being a student and a victim of depression, I want to explore more on this topic. What are the kind of basically reading resources or seminars to attend? Tanmay, would you like to help guide Aditya on this?
Yeah, sure. Aditya, if you reach out to me, my email ID is on my website. I've shared a link. I'm happy to send you like a customized list of readings. There isn't much that is rooted in our kind of realities. Much of the readings, etc., media coverage, etc., is still very predominantly Western focused. So just drop me an email, and just for whatever it's worth, not a very subtle plug, but I do have phenomenal writers coming in writing about various issues on sanity. It's all free to read. So check that out. And if you still are interested in exploring more, then just drop me an email and I'll help you.
Lavanya, where do you go to for your resources to read up? Do you have a circle of students who sit down together and discuss these issues? A peer group or something?
I usually read articles online, and I don't have a support group per se, but I do discuss it with my friends who are like-minded and love to delve into such issues.
Chavi, the idea of weaving mental health into school curriculums, did you see that happening? Or do you think that's important that we start doing about it? I mean, in India, and most of the issues when it comes to anything sensitive, we tend to either just brush it under the carpet or think of it in a certain prism. On mental health in particular, how can that be integrated into the school curriculum for children to young age?
I do feel it is it's important to integrate that, and also for people to be able to recognize that there is something or there is an issue. I personally feel that the sooner it is addressed, the better it is, not just for the individual, but also for the professionals. And as Dr. rightfully pointed out, even when we are sick, that is what, even within, say, my own household, where one would expect one to be aware and educated, that's just what we tend to do. Like, okay, I've just got a minor cough and cold, it'll go, doesn't go, gets worse. And it's only when it's beyond your control that you suddenly go out to seek help. But in the mental health space, I feel the damage done by then is far, far worse. I'm not really being dismissive of the health in itself, but I think more so in the mental health space. So yes, schools should definitely have that, because often also I feel, especially now that mothers and fathers both are working, the support system may not be enough within the household. And therefore, I think in schools, it could be provided. And as has also been spoken about, friends, peers, family members, communities, if there is that sense of a safety net. And I've seen that with women and young girls in my own village, even before I got onto the college, running the college and finding this lovely lady who helps in the mental health space. But just having that circle of trust and being able to provide that, where people just by communicating their issues and realizing that, hey, it's not my problem alone, there is someone else, and then you discuss it and find a common solution, that in itself is very liberating and also gets them out of whatever issues they may be going through emotionally and mentally. And I think that is very, very doable. But yes, it is also important that the guidance is the correct one and not dismissive, which it tends to be, or saying that, oh, it's okay, just give it time, or take a break, go out, do something different, dance a little. But that alone doesn't really help. It does need to be addressed. It does need that support that Lavanya said she got from her parents. And I'm sure all of us do have friends and family we can reach out to. And with the experts we have right here, I would just appeal that just somehow, and what can we possibly do to spread that knowledge and get that spirit going, so that we can actually be there for each other, because this is a very, very sensitive subject which has to be addressed appropriately. And of course, we all know there are a lot of people who, even if they're trained, they do tend to misguide or not appropriately treat the individual, and that leads to repercussions that we'd rather not hear of.
It's interesting you mentioned one of the most common sort of things that a lot of people in their bid to be supportive do is, just ask a mentally depressed person or somebody who's suffering from anxiety that, hey, zap out of it. I think it's one of the common conversational mistakes that people tend to do. Some quick questions here. I think there's also a problem here because Ram Prakash, what he's asking Dr. Pathare, is there any government university or institution where a mentally challenged youth can get the education according to his level of brain? I mean, there's mixing up of mental health issues with mentally challenged people. That by itself is a problem area. Another Jennifer is also asking, are there any special schools? What would you like to tell them?
Well, I think we are talking about two different issues. I think what they're asking about is people who have intellectual disabilities as opposed to a mental illness. And clearly there are schools and resources for people with intellectual disabilities, and they would have to look for it in their own cities or villages where they are at. So I think these are two completely different issues. People with who have intellectual disabilities have a lifelong disability, which can be remedied in a way by whatever help that they get from schools and from teachers. Mental illness is a completely different ball game in a sense. While mental illness also causes disability, it is not that there is treatment for the illness part of it, and the disability can be addressed in many ways. With intellectual disability, really there's no treatment per se, as in like the way people understand treatment as curative treatment, but really it's a disability which needs support.
There's a very specific question that Abhilasha has, Dr. Pathare. She's asking, recognizing only clinical psychologists holding an MPhil as trained professionals is creating a barrier for wider mental health services to evolve. Aren't we restricting the field by keeping it as a subset of psychiatry?
Well, this is an ongoing problem, and what I would suggest to you is that really you should have this conversation not with me, but with the psychology profession itself. A lot of these kind of restrictions have actually been put in by psychologists. At one time, the demand from the Psychologists Association was that only people with PhDs should be recognized as clinical psychologists. And currently there is a bill in Parliament which is called the Allied Health Professionals Bill, which actually provides for other psychologists, people with a master's, even to be recognized as psychologists. But then again, the psychologist community is unhappy about being in that bill, because they say, well, we don't want to be clubbed in with other health professionals. So, you don't want to be with the psychiatrists, you don't want to be with the other health professionals, and you also don't want to recognize anybody who doesn't have a PhD. Now, that creates a really complicated situation if you're trying to address the public health need for psychology or counseling. And what it results in then is actually, if you leave any empty space, it gets occupied. If you don't have enough people who are qualified in some way, regulated in some way, and certified in some way, then unqualified, unregulated, uncertified people get in there and start doing things. So, that's a real problem. But I think it's for the psychology profession. It's not for me to suggest what they should do. I think it's for the psychology profession to actually come up with some kind of a sensible way of being able to regulate itself and decide who should be called a psychologist or not called a psychologist. You don't want an overly restrictive definition, because then you'll have not enough people. And you don't want a laissez-faire where anyone can call themselves a psychiatrist. And then between these two extremes, you need to actually try and come up with a more sensible way of doing that.
Right. In fact, Tonmo actually feeds into the next question. Maybe Tonmo, you can answer it. Brinda Bhagat wants to know that there are many mental health services, apps, and websites that don't even have a warning for suicide prevention helpline numbers. Is it just a business boom during the pandemic? How can there be a policy frame to regularize this?
I'm so glad that question came up, because I was going to raise my hand and make that interjection actually, because we are largely dealing with a young demographic. And I think in the last 2.5 years, about 30 months, we've seen this massive boom of VC funding coming into the mental health tech sector. And the way in which mental health tech is being treated, it's pretty much like food delivery or e-commerce or other kinds of apps. I'm generalizing, of course. There may be one or two apps that are doing it right, that are building things slowly. We have to understand the philosophy that most of these apps operate with. It is the philosophy of saying that, look, there are vast swaths of people out there who don't have anything, who don't get access to any kind of care. So here, take an app, at least now you have something. And that is just such a morally corrupt argument, because what you are saying is these people don't have any kind of care. Now let's give them some care, which could be dangerous, which is unregulated, which could backfire and put people in mortal jeopardy. But let's give them some sort of a placebo. At least a placebo doesn't harm people, but this can actually actively harm people. So I completely agree. This has become sort of this vast unregulated wilderness. And unfortunately, it is very difficult to regulate this because, mental health players, they often play around with the nomenclature. So not everybody will call their apps therapy apps or mental health apps. They will say wellness apps, they will say well-being apps. And that is very, very difficult to regulate. You can't regulate wellness platforms. And secondly, which is again a very major concern that I have, and I've started talking and writing about it a lot, is the data implications of this. We know the situation of data privacy in our country. We have a bill that has been, sitting somewhere. We are yet to see what form it finally takes. And in this environment, and I've gone through the privacy policies, which are kind of tucked away somewhere in the bowels of the app or a website. It is horrifying to see the kind of things that they expect to get away with. And already we've had incidents, including earlier this year, we've had incidents of cyber crimes against major mental health institutions all over the world. In March, we had 3 such incidents, including one in India. Many of these apps, because they're unregulated, and the lure of all this user data. Crisis text line in the US was found sharing user data of people undergoing suicidal crisis with a for-profit sister company. That is just the pits, So I think young people need to be very, very, very careful, because for the vast majority of them, the first port of call now when they need mental health care is an app. And it could be a peer-to-peer support app, or it could be a chat bot, or it could be anything. And I'm not saying that all the founders out there are doing it for duplicitous reasons, but caveat emptor, consumers have to be very careful. And if the first thing that you should read is the privacy policy. And if anything stinks, just stay out. Don't use anything that sounds fishy to you.
And we're coming to the end of this conversation. I see a lot of chat happening in the chat box, and I'm glad that people, students, young people are actually exchanging their own experiences of what they are living through. For each of you who is facing a lot of mental health issues, first of all, it takes strength to talk about it. So if you are talking about it, I must congratulate you for doing so. And please continue these conversations and be there with each other. I'll just take 2 last questions here. Shravya has a question for Dr. Pathare. Shravya wants to know, is underutilization of funds allocated for mental health true? And she wants to ask Chavi whether the government or policymakers or researchers are focusing on digital therapeutics, perhaps elaborate a little bit on the use of technology. Dr. Pathare, would you like to go first?
It is true. I mean, you can go on our website. We have a India Mental Health Observatory, which basically monitors and tracks this thing. You can go on our website and you can look for the last 5 years, what is the level of underutilization, and it is dramatically high. Again, now I have to say that underutilization is for one part of the funds. The other part of the funds, like for the district mental health program, the problem is there is not much transparency. So if somebody asks me how much of the district mental health programs which are allocated to districts for service provision are underutilized, I can't answer that question because I can't get hold of that data from any of the government sites. What I do know is that, for example, there is one part of the mental health budget in the union budget, which is for the national mental health program. And that one, which is almost in various years, has ranged from 70% to 80% to 50% underutilized, not utilized. So clearly there are parts of the mental health budget which are not utilized. Large parts of the budget which goes to to NIMHANS or to CIP Ranchi or to the hospital in Tejpur, which are central institutions, get 100% utilized because hospitals are good at using up the money. That's what it shows you. So, and when they want to, they will. So yeah, there is an underutilization of funds. Again, don't forget that while everyone, when they say what the money is given to mental health, everyone thinks about the union budget money. But remember that actually health is a state subject and mental health is a state subject. And that many states actually put in a substantial amount of money into mental health. Unfortunately, the way it is done and how it is done, it's impossible. We are trying to analyze state government budgets to find out how much money, to answer a simple question, how much money does a state give to mental health? It's impossible to answer that question because of the way budgets are given out. For example, in many states, mental health services are provided in district hospitals. Now, the budgets will say money spent on district hospitals, but it will not say how much of that district hospital money was spent on mental health care. So I have no way of knowing what was spent on mental health care. So, in fact, one of the things that is a real problem is I don't think anyone, even in government for that matter, I mean, you talk to the governments also, even in government, I don't think anyone knows how much is actually allocated to mental health care and how much is actually spent on mental health care. If somebody came and said, give me a figure, nobody knows. So what we have are these figures which come in the union budget or somewhere else, but these are not the only figures. There's a whole host of mental health funding which seems to be going off somewhere, which we don't know what is happening. But
Right.
underutilization is a fact. I mean, I'm not trying to say that that is not true.
Right. Chavi, to the question on digital therapeutics and technology usage.
Sure. I do feel that during the pandemic, that did come in the forefront, and through the government.
Chavi, if you switch off your video, I think the audio will be clearer. There's an internet issue.
Many initiatives, at least with the task state that I'd heard of. So that was good to see. Yeah, yes. I think there's a bit of an. Apart from that, I did lose you guys in between because of electricity.
Go ahead now. Your audio is clearer.
As well. Can you hear me better now? Is that better? Am I audible?
Yes.
Yep. Okay. What I was saying was that during the pandemic, the government definitely did utilize the digital platform to provide support to people. And I think that did come in handy, and it was used appropriately on the urban cities as well. So that is something that I do know about the state. What happened post-pandemic, I'm not too sure. And the good thing was that through these digital platforms, people had access to help not just from by people within the state, but also had access to people from different states.
Chavi, I'm afraid we are.
And that was very interesting to see. But I do feel a lot more needs to be done in a more.
Okay. I think, your audio is waning in and out. Tanmay, would you quickly like to come in on how technology can be harnessed more to deal with the subject?
Yeah, I think one very hopeful development this year was the announcement of the National Telemental Health Program. And I say hopeful, I mean, we are yet to see the contours of that. I had actually filed an RTI with NIMHANS and I barely got any answers because it's still very early days. But I feel like something like that, if implemented properly, if staffed with qualified, well-trained people, has far greater potential of reaching down to the masses than apps, etc. So I feel like mental health is not a problem that technology can solve. It is a very tempting solution. It can play an augmenting role, etc., etc. But the frenzy that we're seeing right now, I'd say, again, unfortunately, the responsibility to be discerning is really on the consumer. And in this, I am as a user survivor myself. I also differ when I have to think of calling a helpline or using an app, etc. I'm not sure, and I always tend to be conservative. So we are at a stage right now where it is very exciting. As a journalist, I find this very exciting, but also very, very potentially very slippery. So right. Yeah.
I mean, like Anushka here mentions that we need to be anonymous also. I don't want my family to know whenever I seek help for being suicidal. I think some people are not comfortable talking to their family. Chavi, just quickly, your last comments here. I'll take your comments from Dr. Patare and Lavanya too.
Yep. So I'm going to go back to what I was saying, which is that during the pandemic, the digital platform was used, and I think it was also utilized fairly well by the government, which created the awareness and granted people access outside of urban spaces as well. And that was really nice to see. But I think it has to be utilized far better. Yes, it has its pros and cons, but I think that's also probably because even those who are professionals, for many of them, the digital medium was also new, relatively new. But I think this would perhaps be a good way of being able to reach out to a larger audience because the need is there. And I think it's only going to be increasing. You look at climate change, you look at the pandemic, what have you, the economic instability, and so on and so forth. And with all of that, there is more need. The good thing is that people are talking about it. The awareness is slightly better, but yes, it needs to be far more. And for a country like ours, with the kind of diversity that we have and the expanse that we have, I think this is perhaps the only medium through which we can actually reach out to help people in a wider manner than, say, physically.
Okay. Thank you so much, Chavi Rajawat, for those comments there. Lavanya, in conclusion, what would your message be to people, even in terms of your own lifestyle issues that, how do you go about dealing with? Are there certain practices that you've adopted to try and take care of your anxieties?
So what I would recommend is to everyone that you guys must be having that one friend or that one family member. There is at least someone who is gonna understand you, who loves you unconditionally, and opening up to them will help a lot, trust me. So whenever I went through a tough phase in my life, I isolated myself, and I thought it's better not to tell about my struggles to others because it would just upset them. But when I opened up to them, I realized that how therapeutic is it to get something off your chest. So there is someone who does care about you and is there for you. You should please reach out to them. They'll help you in some way. So company matters a lot.
Yes, and I think that's something that you've addressed. Your brother has portrayed beautifully in that short film, It's Not in My Head. Initially, he's very hesitant to talk about it because, even his own brother in the short film actually says that he's behaving like a weirdo, he's behaving like a jerk. And obviously, they're very hesitant about talking, but it's, as you said, it's important to have the strength to have the conversation. And Dr. Pathare, in your Twitter thread, and for those of you who want to follow our panelists, their handles are all mentioned there. Toy Mango is there for Tanmoy Goswami. Dr. Pathare is on Twitter as Netshring, and Chavi is there as Vilit Soda. Dr. Pathare, your pinned tweet actually talks about the myths of suicides and suicide prevention. And one of the tweets says that a person who's suicidal is determined to die is a myth too, and it is false because au contraire, suicidal persons are often ambivalent about dying. Emotional support at the right time can help prevent suicide. Your final words here in people on, how to go about trying to identify these triggers and to make sure that, you're talking to somebody who may just be on the, having extreme thoughts mentally.
I've already spoken a lot, so I'll try and keep this to a 30-second soundbite if I can. Just remember that if you are feeling suicidal or if you know somebody who is feeling suicidal, then take it seriously. People do not, it's almost very rare that people want to die. As I said, they're ambivalent. And if people get help at the right time and the right person, then they actually survive. And you don't need to be any specialist to be able to do that. That's the other thing. People think, oh my God, how can I help them? I'm not trained. You don't. What you need is just your simple humanity. A lot of work that people do at suicide prevention helplines is actually also they have learned the art of listening. Have learned the art of empathizing with somebody and not having to feel that you have to jump to solutions. Very often people are not looking for a solution. If they can ventilate, if they can talk and they're able to discuss with you, that's much more helpful than having to say, well, I have a suggestion and a solution for you. So I think just, more than offering solutions, the thing that you probably need to do is to learn to listen.
Right. Chavi, do you have anything to add? I see your hand still raised.
Yes, I do. Even for the people who are here, and I'm glad we have the audience that we have. So thank you, everybody. I just want to say that we have to realize that we're all individuals and human beings, and it is okay to say, I am not okay. Whether you're a man or a woman, a boy or a girl, it doesn't matter. And I think that is something we need to recognize.
Chavi, I'm afraid the internet's not allowing for us to get your audio clearly. So we are losing your audio, Chavi.
People
I'm afraid we're losing the audio.
Small.
Tanmoy, just in, Swarali has a comment here that says stigma, labeling, prejudice can only be broken free from with groundbreaking work, working at grassroots levels, more on the fields, like Dr. Patare sir mentioned. We are a diverse nation and we need a diverse approach. Finally, Tanmoy, in media for us, it is a daily learning curve. I raise issues of mental health on my news bulletins. We make mistakes. I'll be honest about it. Even during the creatives that were put out for this seminar, thankfully, you pointed out to the fact that we had used a triggering image perhaps, and then it was taken down, and apologies for that. But do you see any signs of improvement when it comes to the traditional newsrooms in dealing with the subject?
The traditional newsrooms, barring one or two, no. And we have to understand that we often only engage with English media. The situation is terrible if you look at other Indic languages. There are always exceptions, but I get a lot of hope from sort of the new age digital newsrooms. A lot of them are doing exemplary work, and I think it has taken us years and years of advocacy to get here. But I feel like there's finally a realization that asking reporters to report responsibly on mental health and suicide issues is not censorship. It's not about telling people that you can't write, you can't report on an issue. It's just being responsible. And that, I think, with CMHLP, we've run a very successful program training reporters on how to report on suicides. That has been very well attended. And I think we had the first ever awards for responsible reporting on suicides last year that I was privileged to be a jury member for. And we got some outstanding stories that really brought out the human dimension and the biopsychosocial nature of mental health and suicide. So I think the charge is being led once again by more new age media organizations, but I do see a handful of legacy media companies also making an effort. And just to finally conclude, this is actually a credit to Dr. Patare. I remember during a couple of years ago when we had that very unfortunate tragedy with a celebrity. And there was a lot of misreporting in the media. And I think Dr. Patare and I were 24/7 on Twitter, calling people out and asking them to correct their reporting. And we actually had one major news channel in Orissa come on Twitter, acknowledge that they had made a mistake and pledge that they will do better. And I have never seen any television channel in India do that. So I feel like there is hope.
Okay, of course, as I said, it's a learning curve for everyone, and as long as we are willing to be open to admit our mistakes, learn from them, I think that is very, very crucial. But thank you so much, Dr. Soumitra Patare, Tanmoy, Lavanya, Chavi. Apologies, we lost your audio connection for the last few bits. But and to each of you, I see a lot of you out there who are talking about your depression, your anxiety, how therapies aren't helping. Tanmoy has put his email on the chat box. Please feel free to reach out to our experts and continue having these conversations. However, in fact, challenging the circumstances feel like, or if you don't think that you have somebody at home, reach out to the experts. And I really hope that you're able to deal with your issues in a way better manner. But thank you so much to all of our audiences tonight who joined us in this discussion, and we will continue with the Let's Talk Policy series on Kautilya School of Public Policy. Thanks, Swana.
Thank you. Bye-bye.
Thanks a lot. Bye.
Thank you so